Hey, 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 welcome to the P Word Podcast. I am the host, Coach K. I am here with our awesome guest, Dr. Troy Halpern. What it is. This is a conversation about perimenopause and postmenopause, and Lord knows we're looking for the day of menopause. I don't know about y'all, but I am. I'm super excited that we have our sponsor in the house today. Take it away.
Hey there, I'm Dr. Troy Robin Halpern of the Cosmetic Gynecology Center of San Antonio, and I do cosmetic gynecology, which is an offshoot of gynecology. I take care of women in all stages of life, but focus a lot on menopause and perimenopausal women and their issues. So we can talk about leakage, we can talk about dryness, we can talk about how your sex drive changes and how you cry all the time. And
Sex drive.
and we can find ways to help make your life a lot.
Because this is a subject that I think everybody needs to be talking about, at least if you're a female over 40, right? What got you into this? This is one of the things that I feel like you really are a trailblazer because you have helped me really. I know just in the time that I've met you. So, what got you into it?
Well, thank you. So I did obstetrics and gynecology for a dozen years. I'm an OBGYN by training.
Okay.
And I've always been interested in female health.
Mm-hmm.
And so even when women come to me now with surgical issues, I look at the person overall. I take care of the whole person because everything interacts and everything is connected.
Right.
So it's very important. And so hormones
Mm-hmm.
are what drive us. They make us female. And everybody who is female is going to go through these changes. And these changes can be disruptive and they can affect our daily lives, how we feel about ourselves, how we feel about other people, sexual interaction, our moodiness. And so all of those things can be impactful.
Mm-hmm. It is time to get down to the P. We're going to take a sip on that one. Make sure you get your glass. Mm-hmm. Mm-mm. Let me tell y'all, love a good cocktail. Delicious. I'm sorry, you're on duty. You're a doctor. You can have one of these, but we got you after. Our first question is one that I think that everybody wants to know. How do you know you're in perimenopause? What do you do? How do you know you're there?
Well, life changes and you start to feel a difference in your activity over the course of time. So, in my practice, I've created a 20 symptom checklist. And I ask all my ladies when they come in to take a look at this list if you're 40 and over. Because if you see yourself on this list, you're very likely to be in perimenopause. So, hot flashes, irritability, weight gain, depression, headaches, insomnia, dryness of your vagina, decreased sex drive, urinary issues. And so all of these, even hair loss and joint pain. And so it needs to be evaluated because hypothyroid and underactive thyroid and depression can all overlap with perimenopause and women can get misdiagnosed. And so it's important to have blood work to make sure the thyroid is normal, okay, and to check the estrogen levels, your progesterone. FSH is the hormone from the brain that stimulates the ovaries, and when the ovaries aren't responding, the FSH is high. So that's one of the blood tests that tells you that you're menopausal, okay? But in perimenopause, the ovaries make estrogen in a pulsatile fashion. So some days you're making more, some days you're making less. And so a blood test may not always tell you if you're in perimenopause because if they catch you on a good day of ovarian hormone production, it doesn't match your symptom list. And so I look more at the symptoms than the numbers, okay? Because that's really, you have to take into account at what point in the cycle the woman's getting their blood work tested.
I knew that I was having some symptoms. I've been having symptoms since 36. So I knew I was having some symptoms. Then I met you and we did a chat a couple of years ago and we talked about, some things and you've done some of my events and I started listening. And then I remember I came there and you gave me this checklist. So I said, let me go find it. And I went and I found it. I said, "Oh God, I'm here." One of the things that a lot of women experience is heavy bleeding. I'm not even gonna lie. I just made a video about it the other day. I unsubscribe. I'm waiting for menopause. I want it. I want it. What do you suggest that women who have heavy bleeding, what direction do you go in? Because they'll tell you to have a hysterectomy, and I mean, next thing you know, that's where you are, and you're in menopause, right?
Yes, that puts you into surgical menopause if they take your ovaries out. If they
Ovaries.
just take the uterus, they're not putting you into menopause. The
Mm.
ovaries are what make the estrogen. And so the term total abdominal hysterectomy or total hysterectomy does not actually include the ovaries. It includes the cervix and the body of the uterus. And most women are not given the option of keeping their cervix. And it is absolutely an important support structure at the top of the vagina, and it creates mucus. It makes our vaginas moist and lubricated.
We need that.
And so if somebody has a hysterectomy and takes out their cervix in their 30s or their 40s, they can be prematurely drier because of that. You can be hormonally managed.
Okay.
There are IUDs that can stop the bleeding, the progesterone only IUDs. There is a uterine ablation procedure.
I've heard of that.
So not everybody needs to have a hysterectomy. However, if your periods are knocking you down and you do not have any quality of life, then it is absolutely essential to talk to your doctor about having that uterus removed. Not everything can be managed hormonally. And I actually had a young patient years ago who had 2 children and was just barely 30, whose periods knocked her down for 2 weeks out of every month.
Oh my word.
And nobody would touch her. And I did her hysterectomy, and she thanked me for giving her her life back. And the importance of understanding how to manage this uterine bleeding is really essential in the perimenopause. Right. Not everybody wants their uterus out.
Right.
And even if it comes to that, fight to keep your ovaries and fight to keep your cervix. Now, if they're going to do a supracervical, which is where here's the cervix and they take off the uterus from above, and they just take the body of the uterus away and leave your cervix, that's a good thing. And you can do that in many, many cases, but it's more work for the physician because they have to find a way to get that uterus out. So it's either going to be a small incision on your belly, or it's going to be a couple of incisions if they go through your belly button and they do it laparoscopically. And robotic hysterectomies are being done very commonly now. And I think it's something women need to know they can advocate for their cervix. Okay. And unless there's a reason to take out your ovaries, fight to keep your ovaries. They're your natural hormone producers for as long as they possibly can be.
What is life like on the other side of that?
So life is actually better. Women don't have to worry about bleeding. They don't have to worry about tampons. They don't have to worry about cramping. And so it removes that organ that wasn't behaving. Okay, if it doesn't want to respond to hormonal management or endometrial ablation, I mean, we have so many choices. But if it's disrupting the quality of somebody's life, then I think it's an important procedure to consider.
I like the quality of life. I like the statement quality of life. I feel like that is something that we are fighting for during this time, this phase in our life. Like you said, it disrupts us, it derails us. And we're fighting to figure out what's going on. That's the physician. Y'all better get with her. I'm just saying that quality of life when you said vaginal dryness. Now, we're females. We like to, keep it spicy.
You got it.
You gotta keep it spicy.
Yes.
So what do you do about that? What do you suggest that someone does for that?
So unfortunately, when couples, they'll come in and they'll say it's like sandpaper. Having sex is like sandpaper. It hurts. It's painful. And, you can use coconut oil and other kinds of things as temporary solutions, but they're not actually replenishing the moisture or stimulating the cells to create moisture. Okay. And they can actually disrupt the normal vaginal pH and increase the risk for infections. But Vaginal dryness can occur for a number of reasons. One we talked about was dehydration.
Right.
We don't drink enough water, and you want to make your water appealing. So herbal teas are good. Fruit or berries or cucumber in your water, make it spa water, but get more water in, because as we lose estrogen, our cells lose moisture, and that includes our skin and our vaginas. Another thing women don't know is wine and decongestants can also dry up our mucous membranes. And so, women who have a lot of allergies, and especially in Texas, be aware that your decongestants can affect your vaginal moisture. But the number one reason, of course, is low estrogen. And so, how can we restore that quality of life and make sex fun again? So, there's non-hormonal ways to do that, and then there's hormones. So non-hormonally, we have Thermiva. Thermiva is radio frequency. It's a wand that goes into the vagina and stimulates the cells to change, and it draws proteins into the cells that draw moisture in, and it helps relubricate. So for women who can't take hormones, like breast cancer patients, women who've had blood clots or smokers, or they're just not good candidates, this is a wonderful option. And about an 85% of women get good results with this. I've been using it for over a decade, and I've been tracking the data. So just so you know, it can also help with urinary leakage, which can worsen in menopause because the bladder is an estrogen sensitive organ as well. Okay. And the wand helps stimulate collagen to support the bladder and reduce leakage, helps stimulate moisture to address the dryness, and wakes it up by increasing blood flow and regenerating nerves and blood vessels, which can help orgasmic response and sensation. So the Thermival wand can help with the menopausal symptoms for sure.
Is that something that you use repeatedly, or is it a one-time?
So it's a series of 3 treatments a month apart in the office, and then once a year, roughly, depending on your body and how it responds to the treatments. We can also use platelet-rich plasma, or the O shot, PRP. And that can also help the tissues in the vagina regenerate and help relubricate. And it's also great if there's scar tissue that causes pain, whether it's from surgery or an old episiotomy scar. It can help with old wounds and present wounds with healing. So those are the 2 main things I would recommend. And then we also now have a gel called the V-Lift. It's a carboxylator, and it uses carbon dioxide to affect the cells and increase oxygen in the cells. And that also kind of wakes it up and stimulates blood flow and tissue regeneration. And it's great for wound healing and also for the symptoms of menopause.
I got it. Okay. All right, y'all. Cheers to waking it up. We all take a sip.
Surgical. Okay, so let's talk about there's something. Also, soy products, if women don't want to take estrogen, have estrogen metabolites, and they can have a positive impact on the symptoms that women have, the perimenopausal symptoms. Hormones, number one. Estrogen is what your body is lacking, and by putting it back, it's like watering a plant. Okay, without the water, you dry up, you shrivel up, and eventually we all die. So we want that estrogen, we want that water. And so it's really important. It helps keep us at our best, keeping our bodies in balance the way they should be. It can be done topically. They have they have patches, they have creams. They also have pellets and injections, and then by mouth. And just a baseline evaluation that someone should go through if they're going to be on estrogen. Having that pelvic sonogram to look at the lining of your uterus once a year and as a baseline, because estrogen can thicken the lining and create precancer if you have a uterus, and you always want to take your estrogen with a progesterone. Okay, that counteracts the overstimulation. And so it's just a precautionary thing, but once a year when you're on hormones, you should have that lining checked. There's 3 kinds of estrogen in the body, and this is very important to know. Estradiol, which has 2 bonds, is what your ovaries make, and it can be interconverted to estrone with 1 bond and estriol with 3 bonds. Estrone can increase the risk of cancer in our bodies. And so after you've been on hormone replacement, you should have your estrone levels checked to make sure it's not elevated beyond a certain amount.
For you on that is, how has the conversation of perimenopause and menopause happened in kind of moved forwards in the years? What have you seen? What's changed?
I think that the answer to your question is the most important thing that's changed is women are more educated and there's more information out there. And so if somebody is curious, they can start researching. The problem is that not everything out there is accurate, but it gives you something to go into your doctor's office with and say, I'm having these symptoms. It sounds like I have this. Can you evaluate me for this? And I think that's the way to have a conversation. Um, Unfortunately, insurance based practices, the doctors are very rushed and there's not a lot of time for them to answer questions. You come in, you're a breast exam, a pelvic exam, here's your script, see you next year. And that's one of the reasons that I changed and left the insurance based system, was so I can actually spend more time listening and educating. And so I think that that's the biggest problem in the system right now, is the lack of time. But I think that if you go to somebody who just does hormone replacement, you're going to get the attention that you need, as opposed to going to a busy primary care practice or a busy OBGYN practice.
There are hormone clinics popping up everywhere. A lot of women are utilizing them. What do you think about them? Do you said you like you said you should go to someone who specializes in hormone replacement and so forth. But uh, what's the benefit of just going to one of those clinics as opposed to coming to you?
Okay, so let me just say, first of all, I'm not at all saying that OBGYNs or internists can't manage hormones, because they can, but they may not have the time. And so that's really dependent on who the doctor is and if they're willing to take that on as part of what they do, which we hope that they would want to, but they don't all. With the clinics, you need to have an air of caution. You need to make sure they're doing the appropriate steps to evaluate you before and then to follow up once you're on your hormones. So if you have baseline blood work, that's appropriate. If you're followed up 3 months after your initial blood work with another set of labs to make sure and follow up that your symptoms are improved, because sometimes numbers can change, but symptoms don't always change. And then you have to decide, is it the estrogen that needs to be changed a little, or is it the progesterone that needs to be changed a little? I look at hormones a lot like trying on a dress. Sometimes it may say size 8 on the rack, but you may have to try 5 or 6 on before you find the one with the right cut and the style that works for you. So you just want to make sure that you're appropriately evaluated. And if you don't feel like the clinic is giving you that, then you want to seek somebody else for your care.
So that's
I think that
awesome.
medicine has lost that.
It has.
And that's why I fight for that in my practice.
And that, I didn't feel heard anymore. I didn't feel like she even cared about me. And so, very, very valid point.
When you know your body the best, and if you know something isn't right, doctors need to listen when women come and say, this is not right. It's not my norm. And that's really what's important.
Now, time for tools for your toolbox. This is a time where we give something that helps the journey along during this phase of life. So, my tool for the toolbox, is actually exercise. I know, ironic, that's what I do. However, I do suggest that you get in at least 30 minutes of exercise every day. And if you can mix it up, include your strength training, but definitely the cardio portion is really good, I think, for just getting yourself in a good mental place.
So I got two. One is a supportive partner. When you are irritable, when you are sweating in the middle of the night, when you're not feeling for sex, you want to have someone who's going to understand and who's not going to feel put off and not take it personal, and know that you need just to be loved or to be left alone, and have your cool pack around your neck and massage your shoulders. Having a supportive partner would be number one. And the Thermivore wand is number two. No downtime. It's wonderful. You can come during your lunch hour and go back to work with a smile on your face. And you can go and enjoy the results right away.
All right, guys. We want to thank our sponsor for being in the building. And we want to let you know how you can get in touch with her because obviously she is a wealth of information and she cares about the people. So, Dr. Joy, tell us.
Well, I have a wonderful website. It's called cosmeticgyn.net, and you can get a lot of information from it. I have a TED Talk on YouTube called Female Anatomy 101 to give you some of the basics. And if you want to get in touch with us and make an appointment, you can contact us at info@cosmeticgyn.net or 210-615-6646.
Also, guys, if you are not subscribed already, go and hit that button, okay? That's what we need you to do. Go get notified for when the next video comes out. Y'all know I'm a little funny. I drop something from time to time. So we got to make sure we down to the P, baby. You got to be in there. Remember, it's hard out here in these hormonal streets. We here for you.